Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about diabetes, prediabetes, and specifically metformin, which is a drug that is kind of the knee-jerk reaction. It's been around forever. There are some people who go even as far as to say that if you're going to make an anti-aging longevity pill, that metformin should be a part of that. And in general, I don't usually have, there's not a whole lot of side effects with metformin. Maybe get some gastrointestinal, some diarrhea or something like this. But the reality is metformin really making a difference? Because that's really what we care about, right? We look at blood pressure, we look at cholesterol, we look at all of these. And we want to make sure that when we're improving our numbers, that we're actually making a difference in the things that matter. What I always say about cholesterol is nobody cares what their cholesterol is. They just don't want to have a heart attack or stroke. So we get this idea that if we take a drug to lower cholesterol, we're all high-fiving each other and patting each other on the back, and we thought we did anything until we actually look at the data, and it really usually kind of sucks unless those changes are made with lifestyle. Being somebody who's always promoting lifestyle, this should not come as a big surprise. Looking at this very large review on metformin, researchers looked at 19 different randomized controlled trials, covering a total of a little over 18,000 patients. So these are big studies, and they looked at them to see what would be in type 1 and type 2 diabetics, looking at microvascular complications. So specifically looking at renal, kidney issues with retinopathy, so vision issues, and peripheral neuropathy. Because if we're going to improve our numbers, we want to make sure that we're improving the end outcomes, right? What's good taking a drug if it doesn't actually help with the things we care about? So you don't need to sit down for this one. We found that the researchers found that after over all these studies, after all the years, there was no change in end-stage renal disease, so kidney failure. There was no change with the use of metformin, and there was no data on whether or not metformin actually helped with retinopathy or peripheral neuropathy. After all this time, you'd think somebody would have ran a study, unless the data just wouldn't be favorable, so they actually don't want to ask the question. So it's yet another one of those scenarios where people take a drug and they think if their numbers get better, they think they're doing all the right things. I have patients all the time that come in and go, oh, I have high blood pressure, I have cholesterol, or I have high blood sugar, but it's controlled. The second they say controlled, I know that they're talking about using drugs. It's almost like it's like a euphemism for I'm taking drugs, is saying that it's controlled, as opposed to somebody saying I manage it with my diet or something like that. So the metformin is it's a drug that blocks a process called gluconeogenesis, or new glucose formation in the liver. What I always say is that we want to have more muscle mass, because the muscles and the liver both take up sugar from the bloodstream. However, the muscles are very selfish, and they keep it for their own use. They never release it back into the circulation. The liver does. The liver can store the glucose as glycogen and then turn that process around and put the glucose back in the circulation. Unfortunately, the real answer is to have more muscle mass and dietary changes and everything. So that's why metformin works on the liver and not on the muscles, because the muscles already do what the liver does using metformin. So really strongly believe that diabetes is a choice. It's based on the choices that we make, the lifestyle we live, the exercise, the stress, the chemicals we're exposed to. And a lot of people don't want to hear that, because it puts the responsibility back on them. It's not a metformin or a Byetta or a Januvia deficiency. It's a mishandling of the way our genetics are managing our lifestyle is managing our genetics. So So really what it boils down to is what I always say. The only way to truly change those long-term trajectories are with the right lifestyle, which I've talked about again and again. Things like maintaining muscle mass, exercising, proper dietary choices, sunlight exposure, all of these things that can help better manage diabetes or your risk of. As always, I'll post a link to this particular study in the description. Make sure you like this video and share it with somebody who you think needs the information.